All right. Hello, everyone. If you are itchy, snotty, stuffy, congested, drippy, sneezy, you are going to want to listen in today because I have the great honor and pleasure of speaking to Dr. Hana, who founded BeWell Health. This company's mission is to first do no harm, which I think, what a wonderful mission statement of a company. I don't know many out there with something so wonderful as that. So Dr. Hana is a pediatrician with decades of clinical experience, and she invented Nasopure, which is a personal staple in my house and in my clinical practice. So, Dr. Hana, I am so happy to share this time with you today, and I thank you for being here.
Thanks for inviting me. Such an honor that you are welcoming me into your home so we can have a conversation about noses, because that's what I love to talk about.
Yeah, perfect. Well, I have learned so much from you over the years. Maybe you know that or you don't, but you've helped me personally. You've also helped all of my patients because I get really excited to talk about Nasopure with them and to introduce them to nasal rinsing if they're not familiar with it in the first place. But do you want to maybe just start at the beginning and tell us, what inspired you to create this product in the first place?
Sure. I'm an immigrant. I grew up very poor, and I was taught about chicken soup, and you stay away from the doctor unless you're near death.
Yeah.
And then as a young adult, I joined a large spiritual commune in the country called The Farm. And there I truly became a hippie, a spiritual hippie, and grew soybeans. And I became aware of the importance of natural approaches and eating well.
Mm-hmm.
And then one day I woke up and decided I needed to educate myself and become empowered so I can help others, because working on the farm wasn't doing that. And so I went to medical school, and because I was an older student, I think I heeded the mentors that spoke to me. And the ones that spoke to me were the ones who understood the goal of a doctor is to keep the patient healthy, not treat them with Band-Aids, so to speak. And one of those doctors was a pediatric ENT, ears, nose, and throat physician. And he said, Hana, if I could get everybody to wash their nose, I would never do surgery again.
Wow.
10 years after that, he came back for one of his last grand rounds of his practice. And he shared that in that 10-year period, he did almost no tubes in the ears and no sinus surgeries because of nasal irrigation. So when I started as a pediatrician, I had two rules. Don't ask a 2-year-old patient to do something that I couldn't do. Mm-hmm. And treat my patients as I would my own kids. Be careful with the drugs. Inform the parents. Make safe and good choices. So what was available back then was the Neti Pot, the old-fashioned 5,000-year-old device where you make a pretzel. And the idea was wonderful.
Yeah.
But me not being a natural swimmer, the idea of water in my nose was torture.
Mm-hmm.
So, but I knew I wanted to get it done and how to do it. By accident, not because I'm smart, but by accident, I realized when you flush straight back, you're actually causing a vacuum of the sinuses. It feels comfortable. It makes a U-turn, and all the junk comes out. So then I developed that bottle, and it's just a plastic bottle and a good salt mix, and that's all it is.
Yeah. I often tell my patients, I had a Neti Pot for years and it just sat under my, bathroom sink. For some reason, I didn't want to be doing, yoga poses first thing in the morning to be able to get this going. So it was really nice when I learned about this, because it was so simple, like so simple yet so profound at the same time. So
like a toothpick.
Genius.
It's so simple. Well,
absolutely.
Let's talk a minute about the differences, because I think the differences are critical. We breathe 10,000 liters of air in a 24-hour period.
That's incredible. Yeah.
Right? We make a pint to a quart of mucus per day, each human, which is good stuff. It helps collect the debris and we swallow most of it, cough it up, poop it out. But when we're older, when we're on certain medications, when we have certain conditions and certain environmental conditions, our mucus gets thicker and stickier. So when you're using any device, you should be mindful where you're pushing the debris. Think of all the debris that's in the front of the nose. Do you really want to be pushing it into a closed sinus cavity and then it drains out? Or is it smarter to push it through the open passage, vacuum the sinuses, and have the junk come out?
Yeah. Yeah. Genius. So that's what you really talk about with this system. You're rinsing the nasal floor, right? Like you're not, I think people imagine and their first thought is, oh, they're going to drown when they use this, or like, it doesn't seem natural to them to be, stuffing water up their nose, which I totally understand. But this is different. You're, like you said, you're just washing the nasal floor. So you're just going in one nostril and out the other, and there's not that sensation of drowning or burning too, which we'll probably talk about, right?
Dr. Laura, what you're saying is so true. Just the general idea of cleaning the passages in a comfortable way is critical, but you said washing up or putting water up. Most doctors say you want up, and that they don't understand the anatomy. Our nose is made to be able to actually put a Q-tip straight back without you feeling it, other than the hairs being tickled.
Yep.
If you go up, you're irritating the olfactory nerve and you're pushing junk into your maxillary sinus and, God forbid, your frontal or ethmoid sinuses behind your eyes.
Yeah, absolutely. Yeah, that's a huge misunderstanding. And I think just, patients definitely, I totally understand why that seems a little odd at first. It doesn't seem quite natural. But once we get into and explain it a little more, it's like, oh, half of that resistance, I think, and like questionable stuff goes out the window, and it seems a lot easier to understand and easier to do. So
I would challenge any listener to try a nose wash. I have never met a person, I've never been able to make sure that they enjoyed the feeling. It is a new process. Americans are used to popping pills. This is an idea similar to the introduction of a toothbrush.
Yeah.
How did people react when the first toothbrush, you want me to take this wooden stick with bristles and do this? But now you know it's so obvious.
Yeah, absolutely. And it's, I think we wash our hands multiple times each day, but this seems a little bit more foreign to us. But once we get used to that, it just becomes a completely natural, normal thing to do. And I personally have found that, like, if I don't do it, that seems more odd to me and feels unnatural. So tell us a little bit about the burning kind of worry that most people have. Like, what's the deal with that?
The burning, it all starts with our bodies are isotonic. We have a 0.9% saline. We have the amount of salt in our body is a set amount. And if you wash your nose with the amount of salt that is inside the membrane, there's no transfer of shrinking of the swelling. There is some removal of gross debris, big particle debris, but there's no transfer through the membrane of particles. If you add more salt without buffering, it will burn a bit like when you go into the ocean. That's 3% saline, and it's saltier than the body. The
Yeah.
reason you feel so good when you come out of the ocean is because all that salt pulled the extra swelling out of the membranes. It thinned the mucus and made it watery, and it cleaned the nasal membranes.
Yeah.
Nasopure adds a lot of buffering. In fact, 1/3 of its packet is buffered. And that allows a person, a 2-year-old, to use the very strong solution without burning. And when you use the stronger solution as compared to the regular isotonic, it removes 80% of the inflammatory mediators. It shrinks swollen membranes, so you don't need the Dimetap.
Yeah.
The 80% inflammatory mediators removed means that much less antihistamine, that much less nasal steroid. It improves the mucociliary transit time. The little hairs, 17% better filtering. It augments healing of bloody tissues. So if you have a scab, it is the best thing to do is to simply clean it. It will heal from the inside out. And then finally, Dr. Laura, this is the most exciting. We know for sure that the hypertonic makes an environment uninhabitable for bacteria and virus.
That is
Uninhabitable.
huge.
It's just so pure. It's so informative. It's so helpful. And there's no harm in doing such a thing. And so that excites me.
Absolutely. I mean, if everyone knew this before, we've all been trained, right? Like I tell my patients, you don't have seasonal allergies because you have a lack of Zyrtec in your bloodstream, right? But that's the immediate thought is when we experience that to go run to the drugstore and pick that stuff up. What if we could use this as a first line, making that uninhabitable to bacteria and viruses? I mean, that's huge. I get so excited to talk to you about all of this. So I know everyone else will be, excited, I hope, to talk about snot and noses with us today.
And Dr. Laura, if they want to learn more, we can share the reference list with all the studies. And they could contact you or me and continue the conversation.
Yeah, absolutely. That was my next question is, this has obviously been done for generations, this type of practice, not so much here in the West as much, but I think I learned from you that it was 3000 BC that we have record of people using something like this, like a nasal rinsing system of some sort. So I was curious and was going to ask you, there's clinical studies, correct? And you have a whole page of them showing the science behind this and what you're talking about with viruses.
Absolutely. Last year, about a year ago, I gave a lecture to the American College of Osteopathic Family Physicians in California. And there I shared a international respiratory journal from 2017 that suggested every primary physician for rhinitis, allergic rhinitis, sinusitis, basically all nose issues. Primary physicians should use nasal irrigation as their first line. That's an international study.
Yeah. Wow. So profound.
It's very exciting. The question is, how can we share the information in a safe way? The human nature is you get a snotty nose and you think you have allergies and you run to the drugstore and you take that Zyrtec, as you said.
Yeah.
But often, if you do it a second time or a third time, then you'll go looking for another option. In my experience, people will try a nose wash. It'll work for a while, then they'll put it aside. Life will be fine. They get in trouble again. Then they pick it up. When it becomes 3 or 4 times, then they begin to incorporate it into their daily routine.
Sure. Yeah, it's just kind of retraining your brain, what we've all been taught for a lifetime. That takes a little while to unlearn, and to not do that quick drugstore run. So yeah, I agree. Well, also let's tell everyone, and I know this is probably a long list, but I just want to kind of point out all of the symptoms that someone might be experiencing where you and I would say, hey, consider nasal rinsing as your first line. So I'm curious, I actually reviewed this list a little while ago, and some more light bulb moments for me, like bad breath and fatigue. Fatigue is such a major issue for so many people, and often not. I bet no one out there is thinking, oh, I should nasal rinse because I'm tired, right? Like, so there's a lot involved. I'm curious if you could run us through, a list of symptoms that are really common.
Okay. And if I go off track, which I sometimes do, put me back on track.
Yeah.
As a pediatrician, the idea of fatigue and nasal congestion go hand in hand.
Mm-hmm.
If a child, especially a very young child, is not breathing through their nose during sleep, they are not in that deep, deep REM sleep.
Uh-huh.
And the next day, they don't eat as well.
Yeah.
They're crabbier. They're not as focused. Of course, it depends on the age. But in children, a congested nose makes really a huge difference in terms of their general affect and energy for life.
Yeah, absolutely. That's amazing. Yes.
In my last lecture, I challenged the doctors in the audience to please hold their nose for a minute, just to see how it feels to breathe through the mouth. And why is that important? Because if you're not breathing through the nose, you're not filtering that air, including the allergens, the viruses, the pollution, etc. You're not warming the air that reaches the lungs, and you're not humidifying the air. And so it puts your lungs at great risk when you're not breathing through your nose. Yes. So in terms of symptoms, fatigue, cough, postnasal drip, lots of sneezing, nose itching, recurrent bleeding, vague headaches, ear popping, ear issues, asthma, COPD, snoring, people who are out gardening or on a bike or out on a walk come in after an hour or two, you know that you have a lot of garbage in your nose. You can feel it.
Yeah.
You can wash that away and then not deal with the effects. And then those folks, it's a very generic group who have toxic overload, who are the folks who have hyperinflammation. They haven't cleaned up their diet. They haven't cleaned up their environment. They continue to put toxins on their skin, and they're not cleaning their nose. And so sometimes that evolves into generalized fatigue, depression, not sleeping, stomach issues, skin issues, autoimmune issues. Those are all from your body saying, I'm overwhelmed with inflammation.
Yeah. Yeah. I'm overwhelmed. Please give me a rinse. It's as simple as that. So great. And can you tell us, I know just to summarize that it is all connected, nose to toes, right? And
I love that. Yeah.
True in my head when we talk about this.
One of the chapters in my book is as the nose goes, the ears follow.
Yeah.
Unless you have a mass or a genetic immunosuppressed disease or condition, your sinuses cannot get infected unless there's a blockage, unless the little hairs in your sinuses are not working because you were born with a genetic defect. But most humans, I've never met a person who developed a sinus infection that didn't have a preceding nose issue. Can you confirm that that's true for you?
Yeah, absolutely. Yeah, that's just not something that comes about with, like you said, some other preceding, issue.
It always is preceded by a snotty nose. Yep. Same is true with ear issues for children and young adults. Of course, we have to always exclude those conditions where maybe they have a mass or a senior vertigo issue. But in general, you cannot have inner ear issues without nose issues first. And we also know asthma medication, asthma episodes are greatly reduced if the nose is clean. And it just makes sense. If you're breathing through your nose, your bronchial tubes don't have to filter the garbage. They won't cough it out. Why do you cough? You're trying to protect your lungs.
Yeah. Yeah, and also important to bring up, I think, for my patients who are listening, I work a lot with hormone imbalance, and especially after the age of 45, and a lot of people who have thyroid problems. So those two are also issues that can bring about some of the nasal passage problems. When that estrogen level starts dropping, those mucous membranes start to dry up, right? And so that can be a preceding and kind of compounding factor with all of this, or with thyroid disorders, where there's a slowness to the overall body system, where sometimes the congestion can start to occur in the nasal passage throughout the body entirely, but also in the nose. So those are also good things to keep in mind, and to realize, the cause of what starts all of this from the first place.
Estrogen is a wonderful thing. I really miss it. Because without it, our nose really does go through many changes. And that dry feeling, it's almost counterintuitive, but washing your nose with a salty buffered solution actually, are you sitting down, moisturizes your nasal membranes.
Yeah.
It's the oddest thing, but it's true. Yeah. So I'm glad you make that recommendation, because I really didn't see that connection as tight as you made it. But thank you for teaching me something.
Yeah, absolutely. Yeah. I mean, there's so many interconnections within the body. I think we can study this our whole lives, and we're still, kind of chatting through it on a daily basis, and learning things on a deeper level. So I love that. I love that about the human body. Keeps us busy studying.
And we are learning from each other right now. Yeah. And when I suggested that somebody call if they want to talk about noses, to be honest, Dr. Laura, it's because almost everything I know now is from when folks talk to me and I learn from them. And then the next conversation, I can share it. So it's really, we're a community and we're all learning together.
Yeah, absolutely. I see that all the time. I learn more from my patients than anyone else, and medical school taught me a lot, but it's really the patients I work with that teach me so much. So yeah. I wanted to talk to you too and ask you about what I think is another part that kind of complicates this whole system that people may not really know about, and that's that biofilm. Do you want to talk to us a little bit about what that is and why it becomes a problem?
I love biofilm. No. Okay, biofilm is the stuff that grows on your knee after you fell and you scrape the skin off, and it's healing. And it's this mesh of cells and debris. And it often forms in the sinuses if they're chronically congested, and especially if you've been on multiple courses of antibiotics. And antibiotics don't penetrate that. Up until a few years ago, we didn't know what we could do about it. What we know now, excuse my dings and rings. What we know now is that a surfactant, which is like a soap, like baby shampoo, will break up that biofilm. The little pieces of fat are able to snap away and break pieces of that biofilm, allowing the sinus contents to come out. We know this is safe because, believe it or not, baby shampoo is used in the operating room after they do sinus surgeries. They'll sometimes rinse with baby shampoo.
Yeah.
Okay. The other side is that I have two patients that I have personal relationships with who have had chronic sinus and have tried everything. And then they come to me and we talk. I've had many, dozens, who have used Nasopure hypertonic with 1 or 2 drops of a pure baby shampoo once a day in their wash, even if they may wash twice or 3 times a day, once a day wash. And that actually removes the biofilm. And believe it or not, many of those patients have never had a sinus infection since. I don't have $10 million to do a study, but I know that it has caused no harm in my patients that used it. And when I say my patients, I'm including my personal clinical patients, but also people who have used Nasopure who have called me, who I've developed relationships with. They're not really my patients, but I call them that. But I want to share with you, and I've written articles about the biofilm in baby shampoo. There's a new study that just came out of Vanderbilt, I believe, and they're in the midst of studying it. And what is it? It is hypertonic nasal irrigation with a little baby shampoo.
Brilliant.
And the result on COVID.
Yes.
And the preliminary results are incredibly favorable, but it's not surprising, right, Dr. Laura? Something's dirty. They're washing it. It feels better. Hello.
Yeah, it can be super simple. I want to share with everyone, I've had chronic sinus stuff for a long time. And if you recall, I just did a video not so long ago about Nasopure. We were having very severe wildfires here in the West. And so, the skies were totally dark and people were really having to live within just absolute smoky conditions for weeks on end. And so I was, diligent, brought out my Nasopure, did the video, and Dr. Hana was like, hey, you have a little bit of congestion on the left side. You guys can see if you go back and watch that video. When I turned to the side to show you how to use this, you can see right here, there was quite a bit of congestion. There's still a bit, but she said, hey, are you using the baby shampoo? And I totally forgot about that. So started using it, and you guys can see now, if you compare the video from when I did that pass to when I'm doing it now, it's like immense difference. I would say, what do you think, like 80% better?
I think you're 100%.
Yeah.
I mean, but I'm 1,000 miles away from you.
I've got a good camera set up here too, so it softens things. Awesome. Well, thank you so much for reminding of us, and that's a huge pearl. I think clinical pearl for any physicians watching this, as well as patients. That baby shampoo and the surfactant with the biofilm issue is a big deal, and it's so simple to do.
And so inexpensive.
I mean, good.
And there's no risk.
Absolutely.
There's no risk if you're not doing it to somebody, and you're able to stand and hold a toothbrush. That's what the rule is for my 2-year-olds. If they're old enough to stand up and hold a toothbrush, they're old enough to learn how to use Nasopure. If you can block your throat, there's no harm with the baby shampoo. The reason I'm bringing that up is you never want to inhale a surfactant into the lungs.
Yeah. And that, I guess that begs the question. I mean, we've been talking about how useful this is, and, most people would benefit from nasal irrigation, but who are the people that we should be mindful of to maybe not use something like this with?
Great question.
Younger than 2, as you mentioned, can't hold a toothbrush, something like that.
That's right. Someone who doesn't really want to do it, please don't ever pressure them or do it to them. Some moms do it to their kids, and I think that's a big no-no. If somebody has a stroke or cerebral palsy or any issue with their airway, if they've had major surgery, then it's up to their doctor, because I don't know how the passageways have been moved around.
Sure.
And if they ever have any doubt, they could just make a phone call to either me or their physician and ask.
Yeah. Yeah, great. Yeah, good to talk about that. It's not as common, but there are times where it's not appropriate. Um, and then let's talk a little bit about the clean water, issue,
Issue.
because there have been some reports of deaths associated. And I think when we talk through this and when you chat with us a bit about it, it'll be a little bit more clear to people as to why that happened. And that, they don't need to be scared of it, but just something to keep in mind.
So there's an amoeba. It's
Mhm.
not a fungus or a bacteria or a virus. It's an
Mhm.
amoeba. And it loves lake water, it loves cistern water, dirty water. And some small rural areas in the country have water tap that has some amoeba that has been found.
Mhm.
When you swallow amoebas, it gets killed because of the acid in your stomach. In the world, there's, and I actually am going, I was going to do this project, but I hadn't had time before this event. I was going to look up, but I'm going to estimate 2, 3, 400 people in the world over the last 100 years, maybe, has died from swimming or being exposed to amoeba from dirty water.
Mhm.
There's been about maybe 5 cases that I know of in the world where people used dirty water for their neti pot, and then they didn't use salt, and they poured their dirty water with their neti pot into their nose, and it reached their olfactory nerve that goes into the brain, and it's a deadly disease.
Yeah. Yeah.
Greater than 90% mortality. So this would never happen with Nasopure or any wash if you follow instructions.
Mhm.
Bottled water, sterile water, distilled water. My favorite, boil a gallon of water and put it in a giant gallon clean jar.
Mhm.
Use that. Whatever is easy for you.
Yeah.
And if you use at least anything other than more than isotonic, so at least a little more, amoebas cannot live in there. So if you're using clean water, it's not an issue.
Yeah. Great.
The real discussion, and that's why I need to analyze the numbers. I'd like to know why the newspapers, recently, I should tell you, Dr. Laura, a little 3 or 5-year-old boy died from an amoeba infection
Mhm.
in the last few days. And the lake that he was swimming in has been closed. So I'm glad that they're closing that. My issue is when there's been a death because of a nose wash with an amoeba, when it was done incorrectly, it's all over the newspapers and the media, but they do not give the same attention for overuse of antibiotics, drug resistance, death from surgery,
Right.
horrendous risks from sinus surgery.
Yeah.
I just think we should be evenly informed about everything.
Yeah, absolutely. Well, I'm so glad we talked about this because, it's unfortunate. I bring this up to patients sometimes, and their first question is they've heard that media report or one of those newspaper reports, and it's just like disheartening to realize how pervasive that can be without full information, right? And so you get this idea in your head that something, is dangerous and really, the big scaries are all around us, and we, don't, no attention is given to that. So thank you for explaining all of that. I think that makes probably people feel a lot better about any of those reports that they had heard, and that those were specific scenarios and amoebas with no salt and dirty water. And, that's a very different thing than what we're doing here with following the directions of Nasopure. So.
And I think with everything in life,
Mhm.
and especially in medicine, and when you decide what you're going to do to take care of yourself, everything is a risk benefit.
Mm-hmm.
And it seems to me so obvious. If you're using clean water and salt,
Yeah.
you have zero chance of having an issue.
Yeah. Absolutely. Well, I know I'm going to keep using this myself, and especially with the baby shampoo right now, still dealing with kind of detoxifying from those wildfires. Um, what else did I want to ask you? Oh, one other question I'd like to maybe share with our audience is, say they were a little nervous to do the nasal rinsing. They finally did it. It felt pretty okay. They're good with that. Is there anything that they should expect after they nasal rinse that they might be a little surprised to experience, like ear popping for one? I know that happened to me the first time I did it, and I was like, is this okay? You know?
Oh my God, that's such a great question. I actually had that exact question about 2 hours ago.
Mm-hmm.
So the answer to the question depends on how the person is when they first start Nasopure.
Mm-hmm.
If I'm totally clear and I'm using it as prevention my first time, I'm going to feel just clean, open. When I blow my nose, I may hear a pop. It would be a tiny pop, and it's a gentle, and it's a good sign because the eardrum is moving, and the pop means the eardrum, the eustachian tube open and close to let that move. The issue comes, like in your case, Dr. Laura, when you are already congested. So you can imagine the same congestion that occurs in the nose, this is also occurring in the eustachian tube, which is a swollen and shut tube on either side. And when you're washing with Nasopure, the salty water goes along the eustachian tube opening, sucking the swelling out. And it is normal when you're blowing and snorting the water out when you're done. And if you blow by blocking one nostril, your ears will definitely pop. But if you blow your nose like a pig, an animal that doesn't block one nostril, like out of both nostrils, then your ears may pop a teeny bit, but it won't pop a lot. So when you washed, you heard that popping because you had swelling and it was opening and closing. The gentler you blow, the less you'll pop. The more congested you are, the more you will pop, but that will, with each washing, should get less and less. Tell me about your experience when you had that popping.
Yeah, so I had the popping. It was pretty mild, and I think I was just so excited to try something other than sinus surgery that, I figured, oh, it's totally fine. But I know some of my patients get a little bit, nervous about stuff like that, or they experience, I remember I had a patient that said, oh, I can't nasal rinse because it just keeps dripping out all day long. Like it'll just run out the front of my nose.
And I have an answer to that.
Okay, good.
But before that, in terms of the popping, so what we just discussed was a little bit of eardrum movement. That's normal. That's good. That means the eustachian tube is opening and closing. If you've been congested for a super long time and that congestion has now turned into like glue in the eustachian tube, and then you're the kind of person that really wants to blow hard and not follow my instructions, and they blow super hard, they can stretch that eardrum to a degree where you have intense pain down your ear and your neck. But that's from not following the instructions.
Yeah.
And I would encourage anybody who has any issues to call me directly. I bet I could fix it, or I'll buy you a pizza.
That is such a kind offer. Wow, you are amazing.
So then what were we talking about? What was the next thing?
Oh, the dripping.
Thank you.
Yeah.
Here's a very common reason for dripping, if I may. If you're congested and you're not holding the bottle correctly, which is along the nasal floor, but you go up ever so slightly, then you're squishing the liquid in between the folds of the turbinate and maybe a little bit in the sinuses. So then the salt is sitting against that nasal mucosa, and over time, the water finds its way out. That's why in the instructions, I suggest after washing, you bend at your waist and you tip your head gently from one end to the other to get everything draining out. My experience from the millions of folks I've spoken to is that when they're doing it on a regular basis, they get a sense of how much they're going to drip, and is it going to be for a minute, or is it going to be for 5 minutes,
Yeah.
or is it going to be for 20 minutes?
Yeah.
And they usually can tell, and it will usually get less and less as they get better and better.
Mm-hmm.
So part of the reason is the way they held it, pointing it up into the crevices, but the other reason is that it's working.
Yeah.
It's pulling the extra liquid out. I know this is a problem if you're a teacher. If you're in front of a group, you can't have liquid dripping.
Yeah.
But I wash my nose, I speak all the time, and I don't have that problem.
Yeah.
I think it's the way that people are using it.
Yeah. And like you said, you do it a few times, you'll get the idea of, your timing and that, and, not to just get on your Zoom interview while your nose is still
And you also, many people think they need to use, I used the smaller bottle when I demonstrated a minute ago. A lot of people think they need to use all 8 ounces, and they don't. They don't. They may just want to use a 4-ounce bottle and use one packet, half the bottle, rinse, let it dry until next time.
Done. Yeah. Great. And how many times a day are you typically recommending that people are doing this, or once a week?
I like to say once a day if you're breathing, twice a day if you have any symptoms, or if you're in your season.
Yeah.
If your fall season causes you headaches, why not start washing right away twice a day before the season? And then 3 to 4 times a day if you have a real infection.
Yeah.
The only thing I'd say about 3 or 4 times a day, and this is more preventative, salty water is loved by the inside of the nasal mucosa, but salty water here and around the nostrils will chafe that skin. And so I like to put a little coconut oil or something on my area here, and then I wash. And when I'm drying off, I'm wiping off the oil, and the salt hasn't touched this skin. And so I avoid any dryness.
Yeah, beautiful. Love all those pearls that you're giving our entire audience. Well, this has been amazing. I am excited for people to listen to this. I mean, now in this year of 2020, things that we can do at home that are very simple, that we don't even have to go to the drugstore for, we can do this. We have the power to improve our health on our own, in our own little bathroom, with this super simple little bottle. Like, what is there not to love about that,
Can I say one little brag? Can I do a grandma bragging thing?
Yeah.
I just want to say that the bottles manufactured in Kansas City, and my kits are assembled by adults with disabilities.
I just read that today and just warmed my heart so much. I love that.
And it's always been that case ever since it left my basement, where I used to assemble them right over there.
Right there. That's amazing. Oh,
so thanks for letting me brag about that.
Of course. You can brag about anything here. Is there anything else that you want to share with everyone that you feel like maybe we missed? I mean, I think we did a pretty good job, but.
I love it. I would ask you, would it be okay if we shared my ebook with your viewers if they're interested?
Yeah, absolutely.
Because, like you said, I think information is power. And the best way for you to advocate for yourself and your body and your nose is to understand some basics. My book is written in very plain English because I'm a very simple-minded person. And that way folks can read it and continue this discussion, and we can
Yeah,
learn together.
absolutely. Yes, we would love that. The ebook. And then if they want a Nasopure and they are not a patient of mine, where can they get this?
Well, if they want to go locally, they could go to Sprouts or Whole Foods, um, or they could go to nasopure.com, or they could go to Amazon, or they could call me.
Yeah, perfect. What doctor lets you call them? Oh my gosh, you're amazing.
It
Okay,
filled my heart. I didn't go to med school to sell plastic bottles. I
yeah,
went to med school to make a difference. And
yeah,
I really felt like a nose wash 20 years ago is when I really came out with the company, that a nose wash would help maybe take a tiny step towards the realization that we were using too many drugs for our children.
right.
That
Yeah,
was really, and our parents.
yeah,
Yeah.
yeah, absolutely. I couldn't agree more. I love everything that you do. Your teaching style, I love that it's simple. I love what you've created. So I will share some links down below this video, and we'll get you the ebook too if you would like that. So thank you everyone so much for being here, and I hope you found this interview as exciting as I have, and simple and just beautiful. So thank you.
Dr. Laura, thank you for your work. You're very special, and I wish everybody happy breathing and peace for everybody.
Thank you so much.
All right, be well.
Bye, everyone.
Bye-bye.